Hello friends, I'm so happy to be back, and some of you have been asking why does my arm feel numb after I wake up, or why do I have this pain in one or both my arms. So today we're going to talk about what can be causing this, and stay until the end because I will be sharing some exercises you can do to stretch your nerves. My name is Weber-Salas, and let's begin. We are going to study some of the causes from the simplest to the ones that are a little more complex. And let's start with a slipped arm. It's simply when you fall asleep and your arm stays under your body, or you just fall asleep in a unusual position for a long period of time, and this can compress or stretch your nerves in your neck, your shoulder, or your arm, or all of the above. Second, pinched nerve root in the neck, or radiculopathy. That simply means some nerve is compressed by bone, muscle, or any other tissue. Brachial plexopathy. The brachial plexus is a cluster of large nerves between your neck and your shoulder, which is basically the union between the spinal cord and the nerves that go to your arm. So this plexopathy will be that the plexus is injured. Number 4, we are going to have a stroke or a transient ischemic attack, also known as TIA. And the stroke is a clot that blocks the blood flow to that part of the brain, and from that point on there is not going to be oxygen, so that part of the brain can be permanently damaged, and the TIA is like a mini stroke that is going to dissolve the clot itself. So it's also known as a warning stroke. In both cases, depending on the part of the brain that it's affected, it can affect the sensibility of your arms. Number 5 is diabetes. High blood sugar levels can affect the nerves and cause a diabetic neuropathy. So the numbness usually starts in both your feet, but there are some rare cases where it starts in the nerves of your hands or arms. Number 6, carpal tunnel syndrome. The carpal tunnel is the narrow pathway that you have on your wrist, both your wrists, and the median nerve is going to pass through it with some tendons, as you can see. And what happens in this syndrome is the narrowing or some inflammation that puts pressure on the nerve that's inside of it. Finally, we are going to talk about heart attack, and you can feel all together with chest pain, with shortness of breath, and with cold sweat. You can feel some pain on your arms. And since we're talking about heart attack, I wanted to talk a little bit about the difference between the symptoms in men and women. So in men, you're going to feel the pain on your jaw, on your shoulder, and down to your arm and hand. But in women, you are going to feel some vomiting, nausea, and indigestion. You can also feel cold sweat or extreme fatigue. So be aware, and in case you're feeling like you're having any of these symptoms, please call 911. As you notice, these are some causes, but I cannot tell you specifically what is happening to you. So my recommendation will be for you to go to a health professional and see what is happening specifically in your case, so you can find out rather earlier than later. But there is always something you can do, so here are some exercises you can do to stretch all the tissues around your nerves so your nerves can work better.
I want you to follow my lead and do exactly what I'm doing.
First, you're going to feel your median nerve. You can see it from another view. And then you're going to feel your ulnar nerve. You can do these exercises for as long as you need to, or until you feel that it's not stretching anymore. And finally, you're going to feel your radial nerve. Practice these exercises. Let me know in the comments if you try them, if you felt the nerves through your arm, and I will see you in the next video. Ciao, ciao.